Biparietal diameter, BPD, in obstetric ultrasound. Introduction. Hello everyone and welcome to Ultrasound Academy. Today we will discuss one of the most important fetal biometric measurements in obstetric ultrasound, biparietal diameter, commonly known as BPD. BPD is the transverse diameter of the fetal head measured from one parietal bone to the other. It is one of the key parameters used to estimate fetal gestational age, monitor fetal growth, and assess fetal development throughout pregnancy. What is biparietal diameter, BPD? The biparietal diameter is the measurement of the fetal skull from the outer edge of the near parietal bone to the inner edge of the far parietal bone. In simple terms, it measures the width of the baby's head. This measurement is usually obtained on an axial section of the fetal head at the level of cavum septi pellucidai, CSP, thalami, falx cerebri. A correct imaging plane is essential for accurate measurement. Why is BPD important? BPD helps us estimate gestational age, assess fetal growth, monitor fetal well-being, compare growth with standard charts, detect growth abnormalities, assist in estimating fetal weight. BPD is most accurate between 12 and 28 weeks of pregnancy. Correct ultrasound plane. The ideal BPD plane should show continuous midline falx, symmetrical skull shape, cavum septi pellucidai, thalami, absence of cerebellum and orbits. The fetal head should appear oval and symmetrical. How to measure BPD? The measurement is taken outer edge of the proximal skull wall to inner edge of the distal skull wall. This is called the outer to inner technique. Always place calipers perpendicular to the midline falx. Improper caliper placement can lead to significant errors. Common BPD values. Approximate values. 12 weeks, 21 millimeters. 16 weeks, 34 millimeters. 20 weeks, 47 millimeters. 24 weeks, 60 millimeters. 28 weeks, 72 millimeters. 32 weeks, 82 millimeters. 36 weeks, 89 millimeters. 40 weeks, 95 millimeters. These values may vary slightly depending on population-specific charts. Clinical applications. Estimation of gestational age. In the second trimester, BPD provides reliable dating when the last menstrual period is uncertain. Assessment of fetal growth. Serial BPD measurements help identify intrauterine growth restriction, IUGR, macrosomia, growth abnormalities. Estimation of fetal weight. BPD is combined with head circumference, HC, abdominal circumference, AC, femur length, FL, to calculate estimated fetal weight. Factors affecting BPD accuracy. Several conditions can affect accuracy. Dolichocephaly, long, narrow head shape. Brachycephaly, short, broad head shape. Multiple pregnancy fetal head molding, congenital skull abnormalities. In such situations, head circumference is often more reliable than BPD. Common mistakes. Avoid measuring at the wrong level, including skin thickness, oblique scanning planes, incorrect caliper placement, measuring asymmetrical head sections. These errors can significantly alter gestational age calculations. BPD and head circumference. Although BPD is useful, head circumference is generally considered more reliable because it is less affected by abnormal skull shapes. Modern fetal assessment usually combines both measurements. Practical tips. Obtain a true axial section, identify CSP and thalami, ensure symmetrical skull appearance, use outer to inner caliper placement, confirm measurement with head circumference, compare findings with gestational age charts. Conclusion. Biparietal diameter is one of the most important measurements in obstetric ultrasound. A properly measured BPD helps determine gestational age, evaluate fetal growth, estimate fetal weight, and monitor fetal development throughout pregnancy. Accurate technique, proper imaging plane, and awareness of potential pitfalls are essential for obtaining reliable measurements. Thank you for watching. Please like, share, and subscribe to Ultrasound Academy for more ultrasound education videos.